The deadline for the booster shot rollout has been delayed, raising frustration as a growing number of facilities battle fresh COVID outbreaks. Geoff Rowe is the CEO of Aged and Disability Advocacy Australia. He joins me now from Brisbane. Geoff, good morning. Thanks for coming on the program.
Good morning, Lisa.
And look, can I firstly just ask you how your mum is doing? I understand that she currently has COVID.
Yeah, look, Mum, her 91st birthday present was to catch COVID in aged care. She's locked down. She's doing okay. She's not doing real well, but she's doing okay. Interestingly, she was due to have the booster on her birthday, so clearly that didn't happen.
And now, I guess the first question is, she's 91 years old. Why was she only getting the booster now, or due to get it now?
Look, if I understood, if I knew the answer to that, Lisa, I'd be a very wise man. As an aged care advocate, I'm really confused about how a group of people who were at the beginning of the pandemic identified as priority 1A, the first group that should receive the vaccine, is now languishing in the queue with the rest of the society. Really, in my mind, they should have been, again, at the head of the queue, because we know the vaccine has a limited life, but we also know, and we're seeing it in the current deaths, that older people, and particularly older people in aged care, they're making up about half of the COVID deaths now during the current outbreak. So, you know, they have to be a priority group. The system has failed them.
Geoff, can you just tell me what you see the situation as in various places? And I know that it's not one size fits all, that some aged care facilities have managed to keep visitors coming in and being able to keep that care level high. But what are some of the things you've been hearing about what the situation is today at this moment?
What we're seeing is a lot of aged care providers, a lot of aged care staff working extraordinarily hard to continue to deliver the services that they're funded to deliver. But we're also seeing them really struggle. We know that there are workforce issues. We know people are doubling up on the hours that they work. More concerningly, we know that there is a significant group of older people who are confined to their room and have been confined to their room now for many, many weeks. And one of the things I struggle with is the fact that there doesn't appear to be a time when they will get to see their family and friends again. You know, I heard a comment from one older person where they made the comment they didn't expect to spend the last couple of years of their life in jail. And that's very much what it's become. It's feeling like a prison sentence. The issue of partners in care, look, it's something that I'm really very concerned about. We know that there are a lot of family members who have been part of the care support system for their family member over the time they've been in aged care. And with the current lockdowns, many of those people have been excluded. So for an older person with a cognitive impairment, or any older person really, they don't understand why they no longer have access to their family member. And we know with the staff shortages that some of the support that could have been provided by that family member now isn't being provided. So we're talking about the mental health and the physical well-being of older people. And at the moment, I think we thought in the early part of the pandemic that things were tough, but currently we're seeing a whole new level.
Do you think $800 in payments to staff will make a difference?
I don't think people in aged care work there for the money. We do know that they're amongst the lowest paid workers in our society and very much undervalued. $800 is better than nothing, but we also know that the Aged Care Royal Commission made some significant recommendations about the aged care workforce, about funding for that workforce, the size of the workforce and the remuneration of that workforce. $800 doesn't really scratch the surface.
Geoff Rowe, I'm sorry to hear about your mum. I hope she does okay, and I appreciate you coming on the program this morning and having a chat.
Thanks, Lisa.